Well, and on this Mayor Monday, we are getting another update on the COVID-19 response in cities across our area. This morning, we're taking a closer look at how Vancouver is handling the pandemic. Joining us live over the phone this morning, Vancouver Mayor Anne McEnerny-Ogle. Good morning.
Good morning.
Thank you so much for getting up early with us here. I want to first ask you about some of the news we saw over the weekend. We saw hundreds of Washingtonians gathering in Olympia to protest some of the stay-home orders that are in place. It's very possible that some of them could have been from Vancouver and parts of Southwest Washington. What do you want to say to residents who are really feeling the pain right now and are pushing to start reopening things?
Well, we absolutely understand their pain. We have it with the city and across all of the cities in Southwest Washington. But we know that we need to expand our testing capacity so that we have rapid diagnostic testing and know where our problems are before we open things up. Because whether you call it a faucet or a dial, everyone knows we need to open it very slowly so that we can contain the problem, because we're at the halftime of this game and we're not done yet.
Well, speaking of testing capacity, I know that really is the keystone piece that so many communities are waiting on right now. Where do we stand in Vancouver in regards to access to testing? Can people go to get tested anywhere right now without a doctor's orders?
No, they can't. They need to go to their doctor, their healthcare, and they have very limited testing. We have our 2 hospitals and the clinic that will test all of the healthcare and the first responders, law enforcement, and then those who have symptoms and those likely to have been exposed get tested next. But there is no open testing, and I was sorry to hear that we had a big recall of possibly contaminated testing kits, so that is going to set us back even further.
Yeah, it is an unfortunate step there. Now, I know the Vancouver city manager announced 2 new emergency orders last week. Those are being reviewed by the city council today. Explain a little bit about what those are.
We're not going to open up the special events over 250 people until July, but we can reconsider that if the governor makes some changes. We've continued to close all of our shelter rentals and the playgrounds and such until July. All of that's flexible if the governor says something different. But we haven't opened our community gardens. We'll save that until the 1st of June, along with our community centers. And then some of our construction contracts that were scheduled this year will be canceled.
Okay. Now, I know one bright spot here in trying to help anyone in the community who most needs it. The Vancouver police have joined in this prescription delivery program. So talk a little bit about that for people who might be able to take advantage.
Well, it's for our seniors or those individuals who have difficulties getting to their pharmacies and such. It's not meant to be an urgent delivery, so that people do need to plan ahead a little bit. And it's a temporary prescription delivery. They can go onto the Vancouver City website, find police department, and sign up for that. And then one of our technicians will go ahead and give them a call and find out the who, what, where, and when, all of that, talk to the pharmacy and such, and then go and pick it up and deliver it for them. So it's meant to be used in emergencies. It's not one of those things that is meant for the general public, but more for our elderly and those who are having difficulties getting there. So if they're a resident of the city, we would be honored to help them out a little bit. So it's a great opportunity for us.
It is, and we appreciate the work that all of our first responders are doing to try and help people out there. Mayor, thank you. We appreciate the updates this morning, and I know we'll be checking back in with you as we hope to start reopening things in Vancouver and other communities a little later this year.